Hey, y'all, did you get those emails from the University of Texas?
I got an email about wearing masks, but I'm a little confused what type of masks I'm supposed to be wearing around campus.
Yeah, I remember seeing something about masks, but honestly, there have been so many messages, it's hard to keep track of all the recommendations.
And that is why we did our study. I'm Carrie Stevens,
I'm Kendall Tish.
And I'm Anastasia Harris.
and we want to thank you for listening to our brief presentation today about how employers communicated with their employees um, and helped them make sense of the pandemic and take protective actions.
So, to set the stage, we know we've all been living in the COVID-19 pandemic for over a year now, which is a global health crisis in which we've seen how organizational communication really matters. So, during crises, we know that people look to organizations where they feel like they belong, where they're a part of. And past research has actually shown us that these organizations can play a key role in public health efforts around preventative health. So, because of this, we wanted to understand how organizations are using communication to help employees take protective actions and make sense of a crisis, the COVID-19 crisis. So the theoretical framework that we use to guide this study comes from organizational communication and crisis communication. So from the organizational communication side, we have lists and stories. An example of lists might be those emails we received with a list of recommendations to take from the CDC. An example of stories might be when an employer or someone at your company emails you a story about how their family is dealing with COVID-19. And then we also pulled from crisis narratives and those that are used during crises. And now over to you, Carrie.
All right, so our hypotheses, essentially the research literature would have suggested that you could use lists or stories, and they might have similar effects on our two outcome measures of protective action taking and sense making. So you'll see we have competing hypotheses here. And so that's the way that we set up the hypothesis portion of our study. We also asked some research questions. First of all, because people had to transition from sometimes work from home, sometimes continuing to work outside, we wanted to see if there were some preferences based on work location. Also, throughout the United States, the time period that we did this was the end of May, and the outbreak was worse in parts of the country. So we wanted to see if there were differences there, as well as age. Now, you will notice that we're also using crisis narratives in this research. Because of time, we're not going to cover those findings in detail, but please take a look at our paper because we do explore those and have some interesting findings there as well. So our methods, we used a Qualtrics panel that reflected the US Census. There's some suggestion in the literature that maybe people have a preference for their communication to appear in lists or stories, and so we controlled for that, along with organizational identification. Our predictor measures were how often employers were using lists and then stories, and our two outcome measures, protective action taking and sense making. So essentially, we do find that emails that were sent with more lists actually led to more protective action taking, whereas these emails that contained more stories, they invited people to engage in more sense making. We also found some nuanced differences around work from home and people's preferences, no differences depending on where you were in the US, and some age differences as well. So Anastasia is going to share more about that.
So based on the results from our study, we have a few suggestions about how organizations should communicate using a combination of both lists and stories. So the more that organizations use lists to communicate health behaviors, our research suggests that the more likely employees are to take protective action. And if they need employees to engage in sense making, they should use more stories. And thinking about who's receiving these messages, people who made a transition or worked outside the home, and people who were middle-aged to older adults, they did have a preference for lists. Now, to discuss some of the limitations, the pandemic has continued to evolve. As we mentioned earlier, we collected data over a window of time at the end of May last year. And so our survey was just a snapshot of what was going on in an ongoing crisis. Also, the study collected correlational data, and so we cannot make any causal claims. And the sample was not random or representative. However, it was still based on US Census. And for future research, our findings have led us to think about how to survey participants over time to get more longitudinal data, also how to test differences through an experiment, and also how we can interview employees to get more insight into how they interpreted those messages.
If you'd like to dive deeper into any of our references, feel free to scan the QR code that is up on the screen right now. You just hold your phone up on the camera and it will pull those references up for you. And on behalf of our entire team, we'd like to thank you for attending this presentation. And we hope you were able to learn more about how organizations were communicating with their employees during the COVID-19 pandemic. Thank you.